Hey, I'm Dr. Landon Amonette. I'm your San Diego chiropractor and also known as Dr. Awesome. I'm here with Dr. Johnson. I'm at the Advanced Chiropractic Technique Seminar, and I'm learning all about pathophysiology, neurophysiology, clinical expertise, examination, patient presentations, when not to do the ring dinger, who it's going to benefit, and we've seen already some lives change. So here we are. We're going to go ahead and assess Dr. Johnson and check his posture, okay? So close your eyes and then tilt your head back and forth. That gets your neutral posture without you seeing it. And then you're rotated this way. Your atlas is coming down on the occiput on the right. And if you look down at your hips, you're a little shifted to the right here. Right? Yeah, a little more room on this side.
Yeah.
And then your head is forward just a touch on your shoulders.
Yep.
It's not that bad though, but it is forward on your shoulders there.
Yep.
So
After me looking down, adjusting all day and seeing patients.
and seeing patients.
Floor
all
it in the
time,
Corvette.
right?
That's why the hips translated. You're flooring it in the Corvette.
Right.
Yeah, that's
Yeah.
those G-forces.
Explain that.
Yeah.
All right, lay face down here on the table. We'll get you adjusted.
Okay. Got stuff out of my pockets. Okay.
Yeah, short on the left. Goes long on the right. And that's tight in your lower back, yeah?
Yep.
Go ahead and raise this leg straight up for me. Then do this one. Easier on the left?
Yeah, I get cramps on my thoracics right now.
It does, okay.
Just from doing that.
I'm gonna adjust your sacrum
Okay.
first, and then this SI joint there on the left.
Make sure you drop that piece.
And then do this again for me. And do this one. Does that still cramp you up?
Not as bad. But you want to hit the right sacrum and the right side.
Right sacrum, the other side.
Don't miss any part of the adjustment. You only get it once.
Okay. And then we go up the lumbar, yeah?
Yep.
Now I feel for those subluxations in the T-spine and adjust those.
That's been a problem for everybody since high school.
Breathe for me. Again. Beautiful. One more. Got it. Now we'll go cervical spine. And it's gonna pop up, okay? Right here.
Mm-hmm.
It's like a scoop, right? Yeah, like a glide.
Motion the line of the facets.
Yes, sir. your cervical.
Yeah, you don't want to recoil off of it though. You said hit
Set
it
and hold.
Just hit it and hold.
For that split second.
More P straight down and go down just a little bit more in the inferior aspect there. There you go.
Better
It's better to do the thoracic piece for that one.
for that one.
Cervical and thoracic, I find.
And both of them.
Yeah, you don't want to hit them too many times, so you already got those.
Yeah.
So just hit them once, because if you do it too many, the people will
They'll
get
get sore
and
and
headaches. Yeah.
painful, yeah. Okay, then on your back.
Always remember when the patient comes up, the best time to fold that up.
Pull that up.
Push it, there you go.
Or cervicals first, right? And you have them stretch out
It's
their
okay,
arms
it's
when you
okay
do
if
the
they
cervicals?
do. That's not gonna hurt anything if they do.
Right, okay. And then for this one, it's just cervical, so the drop is just a cervical drop, right?
Lift it up. Yes, sir. Okay, that's 2 AP.
2 AP.
Lift and rotate.
Can you do it again?
Yeah,
We do that one 3 times, right?
yeah, this will be 2. That's better.
Still too much AP though?
Lift it up though. I mean, get a grip and just lift it.
Lift there.
Lift, there you go, better. See,
Oh yeah,
better.
yeah, I felt that, okay, yeah.
Get Y-axis first
Yeah,
and then rotate.
it just
back
drops
the
on its
X-axis.
own.
Right,
Yeah,
exactly.
okay. Alright, then thoracics.
That was much better on that last one.
There's no drop for the, there is drop for the
Thoracic, yes.
So I'm going here, yeah?
You
Bilateral.
want to get on the medial aspect of the acromion process and drive a straight X-axis on both sides.
Oh, like this, both at the same
Yes.
time?
But you want to make sure you got the right contacts on there.
With the drop too, yeah.
Yeah, let's get down a little bit.
There we go. Here, yeah?
You get right on the acromion, it's the lateral aspect. So there you go,
Way out
better,
there.
yeah. That's better, yeah.
Just one there, right?
Yes.
Okay, and then these are
Clavicles, straight
driving out,
X-axis.
out.
uh-huh.
That's a weird one from
Get
this
your
side.
center of gravity over
Yeah,
more,
yeah.
do better, yeah.
Yeah. Still P to A though, wasn't it? Was okay?
Well, it was better. It was just straight laterals are better because the table will drop on it, so you'll have to push the table down. You know, by
Under the
starting
wrist.
there, you know,
Yeah,
the
rib.
medial rib.
Right there, yeah.
That's better.
Yeah, felt that. No, it's still.
Oh yeah.
There you go.
Yeah, good. Yeah, good. Yeah, you don't want to spend too much time on these because if you spend too much time, they'll get sore. They won't want to do it again.
Yeah. Mm-hmm. All right, then your hips.
Yeah. You want to bring it to tension and keep it at tension. Don't get a run at it.
Yes, sir.
Much better. You feel the difference?
Yes, sir. Yeah, I felt that one.
All right. Okay.
Shoulder, yeah. Oh, yeah.
It's a little sore, actually. Yeah, good. Oh, you want to push it on, you want to pull it up. There you go, better, yeah.
Okay.
I do the elbows first. Pull it away from you, get that traction in there, it goes better.
Yeah.
Yeah. Good. Now what, Dr. Awesome?
Now ring dinger.
All right.
Here we go.
Waiting on me backing up.
So right there. Lift you up. So it's gonna bring your legs up and flatten out your lower back.
Yep.
And we're gonna get this first pin in there. And then you're not gonna rotate when I put it in.
Good.
Put that weight in there. Huh?
Okay.
Get that down. There we go.
Oh,
Too much. Do that.
you just want to get it straight up over the hole and then drop it straight down into the hole. Because if you try to do it sideways, it'll warp the holes.
Got it. So right there.
Be a little too-
That's fine. Just get it straight up down and then drop it. Oh. You're putting too much angle in it.
Mm-hmm.
Just get straight up over it and drop it straight out into the hole.
There you go.
How's that?
That's better.
It clicked in.
It's in there.
Yeah, it clicked
You just
in.
want to hear that cluck. Click.
Yeah, I was trying to go too deep with the next hole and that wasn't working. Alright. So we're gonna decompress your whole spine
Okay.
on the y-axis.
All right.
This towel's going around, clench your teeth,
Mhm.
or close your mouth, don't clench your teeth.
Right. Very good. That was good.
Was good?
Yeah. You get
Felt
these guys
good.
out first.
Yep.
This is gonna be the very first thing you're gonna want to get out because that's the most uncomfortable part.
You
of
go
the whole
right
thing.
to it, yeah. And then you always check their reflexes.
Well, I do, yeah. Still kicking.
Still kicking?
Yeah.
And
I think my next axis is good.
Good, is it?
Yeah. It's
Okay.
good.
And then bring you down.
Yes, sir.
Excellent. And then we're gonna help you up. Sideways, always.
Yep.
Good.
Explain to our fellow colleagues why this table is so important to do this adjustment on table.
You can't do without the table. You have to have the table. One is bolted to the ground. It locks in the rest of the spine so that
At the
you get
iliac
that
crest.
at the iliac crest, so you can get that full spinal decompression.
Yeah.
You can't do it right without
And all
the
the
table.
force is in the spine, not dissipating through other parts of the body.
Right, especially when someone else is pulling on heads with towels. One, they don't have the clinical background to know whether or not they should be doing it on the person.
Safely.
Right.
Yeah.
And
Which
then,
is a big concern.
And then two, the amount of force I feel they're gonna have to put into that person's spine because they're not locked in place with a table that has been built to specifications for that. They're not gonna do it right.
Well, and also a big deal is raising the legs up parallel to the table so that you're flattening that lumbar spine down. Then you're getting true y-axis.
Right.
And it's relaxed throughout the y-axis instead of having that lumbar lordosis in there, tightening things up. It'd be really hard to even bring it to tension with the lumbar lordosis with your legs flat.
Yeah, I agree with that, yeah.
So the Y-strap's a whole different, inferior animal compared to the ring dinger.
Yeah,
It's not even
you have
close.
to have the table to do it right.
Yeah.
Don't
And
do
the
it-
training too.
Yeah,
I mean, that's why the Texas Board of Chiropractic Examiners get you guys' licenses and vet you and then grant you a temporary Texas license to come in here so you can adjust us
Right.
and practice on us.
yeah, which has been fantastic.
Yeah, and I want to give a big shout out right now to Sarah Matthews and Jennifer Herchenberg at the Board of Chiropractic Examiners. They're wonderful ladies and they do a great job serving the people of the state of Texas up in Austin. Thank you all for your service and What do you think to the seminar? What would you tell the chiropractic board about the seminar here?
It's been completely professional, well done. I've learned a ton in the last 3 days, and working with them to get everything in place so that I can adjust you legally as a chiropractor in Texas. That's the only way to do it.
Because you're licensed in California.
Yes, sir.
And now you've got a temporary Texas license
In
to
order
just
to
adjust
adjust.
while we're here at this seminar.
That's right.
Which you have to go through the Texas Board of Chiropractic Examiners, and we can help you with all that. We can help facilitate that, but there's a process. This is not just come in and take the seminar and go home and wrap a towel around somebody's neck.
Right.
In fact, he's been under examination all week. This whole week is testing clinical skills, diagnostic skills, clinical decision making, risk management, and technique.
Right.
So it's a very comprehensive clinical seminar
Yeah. it is.
compared to most postgraduate programs that you're just sitting behind a PowerPoint looking at a screen all weekend.
Yeah, the hands-on, in-person is the way to go.
Yeah.
It's been incredible.
Well, welcome to Team Ring Dare, and you're doing a great
Thank
job
you.
so far. He might even pass tomorrow.
Yeah, awesome. Awesome is as awesome does,
Awesome
Dr.
is, and
Johnson.
awesome does. Yeah. Thank you. You gonna shoot me?
Yes, sir.
Okay.
All right, so then pull your head down, get that paraspinal tension.
You don't want to do too much. You just want to get to where it's stretching
Just to
there.
where it's stretched.
Yeah.
So comfort is important.
Right. Because the real stretch is going to come from these muscle spindles relaxing.
And this is the muscle spindle and Golgi tendon organ
Correct.
aspect.
Neurologically, yes, sir. Mm-hmm.
And then you go back, and then mirror image wise, I want to bring you that way.
Yeah.
It seems like most people are that way, huh?
Mm.
Right over the mastoid.
Yep, that was good. Just
And
going
then I do
straight
this side
lateral
too.
in that lateral mass.
With you in that same position, I don't
Yes,
move you.
that's correct.
Right there.
Yeah, good. You don't really need to hit it that hard because all we're looking for is that proprioceptive input into the cerebellum
Right, okay.
for that one.
Awesome.
Because the tiny little muscles up in the upper cervical region, they are filled with proprioceptive afferent
Right.
neurology.
And that little tap, just a tap.
Get that. Plus when you're in a mirror image, what are we already doing? We're already reconnecting the brain to the core again, the body,
Mm-hmm.
by doing massive afferent input into the cerebellum and the cerebral cortex. And then you see me do this last on every patient. That mirror image, again, is working on proprioception into the cerebellum, which controls balance, posture, coordination, all kinesthetic movement, right?
Right.
The cerebral cortex is like the master control center of everything. So the cerebellum connects with the cerebral cortex and it integrates all the information. Then you get an efferent message back from the brain to the body, so you're reconnected again.
Mm-hmm.
Heidi's most recent research publication, it talked about the main aspects of aberrant spinal biomechanics are dysfunctional motor units. You know, and what's happening is when you get a dysfunctional motor unit that feels stiff and sore and is not moving correctly, that inhibits those afferent fibers going up into the cerebellum and the cerebral cortex. So then, whenever that's inhibited that way and you're not getting that full firing afferently into the cerebellum and the cerebral cortex, your brain just kind of goes to sleep. It doesn't pay attention to the core of the extremities anymore. So it really disconnects, and that's when you see people's health starting to spiral downhill because they're not in a constant state of homeostasis like we're supposed to be, right?
Mm-hmm.
Health is really homeostasis, which is a balance of sympathetic and parasympathetics, which is also where you're getting when you do these adjustments on people.
Right. I felt that.
Balancing the sympathetics and parasympathetics.
Yeah.
Because sympathetics puts people into fight or flight. They're anxious or nervous. So if you feel nervous a lot or you're anxious a lot, that's usually a sympathetic nervous system dysfunction, which comes out between T1 and T12. Sympathetic chain on both sides.
Right.
And that all goes in, works into the neurology, into the cerebellum and the cerebral cortex as well.
Mm-hmm.
Your brain is constantly adapting to its environment, both internally and externally. Your vision, your hearing, your smell, your taste, all that are your senses, and that feeds into the afferent information into the brain as well. That's why we have people close their eyes when they're doing their posture, because it takes that visual three-dimensional space orientation component away.
Mm-hmm.
So they drift off to their true biomechanical
Right.
configuration.
Right, where those wires are firing.
Well, because you're not using your eyes, which gives you three-dimensional space orientation proprioceptively. The body will just kind of gravitate, like you saw that one gentleman we had in there this morning.
So far.
He was like, he was
Right.
way down, not only positive SZ, but positive theta X too. Forward flexion on the X-axis as well. Well, it's a great job.
Yeah, thank you.
Yeah, welcome to Houston
Appreciate it.
and welcome
Yeah.
to Team Ring Dinger and Dr. Awesome out in San Diego, California, our newest Team Ring Dinger provider out in San Diego, California. We'll see y'all soon for your Ring Dinger.